seems to me, I feel like the Student Health Coalition came into the coal communities in Campbell and Anderson County and the other counties in the 5-county area. A little bit different approach. People in those old coal camps that were familiar with organizing and familiar with the whole concept of working as a unit, as a group, were the old union miners, UMWA miners. And most of them were retired, older people. They had some concept of, working as an organization, but it was always in that kind of arena of the worker versus the boss, worker versus the coal company. People didn't really extrapolate that whole idea of unity and union over into community, into the community working together to try to get things improved, get their communities improved. I mean, everybody felt very, very helpless with dealing with the courthouse, for instance, in the county politicians. It's kind of like we elect these people, and they don't ever do what we want them to do. They sell us down the river, and what can you do? Throw up your hands. We're never going to get a road in here, such and so. And I think that the Student Health Coalition came in with a different approach, which was, we're not coming in from outside to give you all something like the moral poverty people. We're not coming in here to give out, welfare or give out, free this and free that. We're here to help you empower yourselves to do things for yourself. You can build a clinic, and have health care in your own community. You can get a whole bunch of it together and go down there and pressure those politicians at the county courthouse into doing something for you. But enough of it get together and go to Nashville, pressure the legislature into passing some laws against strip mining. And that was a whole new approach. That was a new thing that a lot of people hadn't thought about in any some of the earliest SOCM members were old union miners because they already had that concept in their mind. But the other people in the community didn't have any sense of what it was like to work, to be empowered, like that in unity.
The interesting thing about just many things that were remarkable, I think, about the Student Health Coalition folks, and one of them is just the degree to which they came in not thinking they had all the answers, or there was tremendous respect for people, and tremendous respect for the potential of people themselves to have some say in what their community needed. And that was encouraged, built. Local control wasn't just a word, it was practiced. And one of the things that I've said to people before is one of the remarkable things is people loved the students. They talk about them as the students. And I never heard a bad word about them inappropriately being snobby or like they flaunting education or something like that. It was a wonderful mix of bringing skills that were very needed skills and tremendous respect for working together in a community to build something together. And it was also not just sort of coming in and leaving. It was coming in and doing some things and coming back and saying what they found and then what do you want to do about it, and forming a primary care clinic, which was a brand new thing to have healthcare right in your community, and being on a health council. And really, some of SOCM's earliest members were members of those community health councils. I mean, it was really the Student Health Coalition that recruited our first members in SOCM. So it was a unique thing. The other thing was with special projects. It wasn't just a service thing. There was, from the very beginning, Bill Dow had this keen sense of social justice and getting to the root of problems. John Gabenta did, who was one of the people who did the special project that formed SOCM. But just the sense that there's an underlying problem here, why there's no money for health care, and what is it? And is it doing a land study that shows tremendous land ownership domination by outside companies and paying almost no taxes in violation of the law. So there was a get to the root of the cause, there was an empowerment feature, there was a tremendously respectful build leadership in the community feature. It's a very unique project.
Maureen,
did you want to say something else?
I just wanted to know one thing that kind of followed on what you said. Several of the people I knew who had Student Health Coalition volunteers, men and women, they liked these kids, and in part, one of the things y'all heard them talking about was, they were down there and they listened to what I had to say. Like, Ruby Canyon people and out and about. And they respected the students because the students respected them. They didn't come in like I'm this big, you got a big education and you're a poor dumbass from the cold mountains and you listen to what I've got to tell you. And, they didn't get that sense at all. And I think that really was one of the things that led to the trust that